Out of curiosity, how many students are in the class? Raise your hands. Oh, come on, maybe more than that. Okay, great. I was told that this is really going to be a Q&A session, and I have a difficult time sometimes when I give these presentations trying to get someone to ask the first question. So I'll make a few comments, and then we'll talk about who has the guts to ask the first question. There's a special prize, by the way, and it's in my pocket. Whoever asks the first question. All right? First of all, number one, I want to thank Western Michigan, particularly Dr. Washington and her staff, for the opportunity to come back. Last time I was here was the end of the season. There were no leaves on the trees. The snow was just melting, so it's really nice to see, the color almost changing. Each one of you, I think, are here for a purpose. Not here in the room, but here at Western for a purpose. You chose healthcare as a profession. And I'm not sure that you can call it profession. You'll quickly find out when you get into the real world, and I'm sure many of you are already in the real world of healthcare, it's a calling. You don't get into healthcare unless you want to make a difference. You may go into accounting because you know ultimately it's probably a decent job. You may go into law school because you know that ultimately everyone needs a lawyer. But you go into healthcare because it's a calling, folks. So no matter what reform brings us, healthcare reform, keep in mind one thing. Most of you in this room will have the opportunity to touch a patient. When you touch a patient, you're making a difference in that patient's lives. Most often, when you're touching that patient in an acute care, non-acute care setting, they're probably at their worst. And so when you get on with the business of healthcare, when you get on and worrying about paychecks and staffing and midnight shifts, never, ever, ever forget what you're there for. That being said, there are some realities in today's world of healthcare. How many here can tell me about root cause analysis? Can you rate? How many here know about root cause analysis? I see a few of the professors raising their hand. That doesn't count. I will guarantee you, 100% guarantee money back, you will know about root cause analysis the first day you join whatever organization you join. Everything healthcare today is about problem solving. And how many have taken classes in problem solving? Raise your hand. Excellent. Talk to your professor. To problem solving, you better have root cause analysis. How many have taken a class in negotiations? Raise your hand. These are what skill sets employers are looking for, folks. I employ 26,000 associates. We hire about 1,200 professionals a year. Every single one of our professionals go through a process. We ascertain their ability to solve problems and their ability to negotiate. Now you may say, what do I need to negotiate? I'm going to be a caregiver. I'm going to be an administrator. I'm going to be an audiologist. I'm going to be whatever. I don't need to negotiate anything. Folks, everything in life is about a negotiation. And in healthcare, you need to be able to demonstrate and represent what is important for the patient. You need to be able to solve that problem as a team member. When we put our folks through the interview process, and we find that this skill set lacks, which occurs in about 90% of our associates, we put in programs so they understand. Healthcare is heading away from these silos. I grew up in healthcare, started my healthcare career in 1971. Probably before many of you in the room were born even. And it was discipline oriented. If you were a nurse, you did your nursing care. If you're a respiratory therapist, you provided your treatments and you left. The occupational therapist, you did the OT and you left. They were silos of care. Healthcare today is moving in a direction that is the most exciting time that I've seen in 3 decades. Young people will talk to me about where and what opportunities are present for me in the future. I say, go into healthcare. we will have some sign of healthcare reform. I can't even tell you what it's going to be this year. I have no idea. But I do know there's going to be a movement. And this movement has been probably more pronounced than any other movement the United States has seen in 2 or 3 decades. Why? Because healthcare, unlike what happened on Wall Street, Wall Street did not touch everyone. Healthcare touches everyone. And so if you want to get to an argument, take a position on healthcare. You'll find somebody who has an opposing view. Take the opportunity to really, really be part of what's happening here, folks. Because it's more than just what's going on in Washington. I had the opportunity to talk to Dr. Washington's staff over lunch. And one of the things we talked about was this is probably the best time to be in healthcare. Because you are going to be leaders of tomorrow. And the thought process that you come out of university with will influence the direction we take. It truly will. You may say, well, I'm not sure. I'm just trying to make it through, the anatomy class right now. Well, you'll make it through. Trust me, you'll make it through. The real issue is what you learn today and how you apply it tomorrow. And you'll come out with a good skill set, a good discipline, a good understanding of what you came here for. But don't forget to walk out with those other disciplines that employers are looking for. It's all about the team. It's not about the silo anymore. It's all about your ability to negotiate teams, to negotiate care that is based on fundamentals. Notions of patient-centeredness. How many have heard the notion of patient-centeredness? Raise your hand. That is how healthcare is going to be delivered. It's that simple. Palliative care, that's kind of a nasty word. It's kind of a word that we use in this country that people are afraid to understand what it really means. What it frankly means is some people will not be able to access certain procedures in pharmaceutical drugs to extend their life care. That there are other options to the end of life other than drugs and technology. That's an area that you will be dealing with head on. My generation, we'd have to deal with it. And we probably won't have to deal with it because the insurance will cover when I'm 95 years old. If I want to have a hip replacement, I probably will get one. But your generation would have to deal with issues of palliative care. So understand that. But I can't emphasize enough this notion of coordination. As you get out, you'll find that you're no longer at the silo, and that your ability to coordinate with other members of your team is going to be paramount. So if you walk out with nothing today, walk out with 2 things. Learn how to negotiate, learn how to coordinate within a team. You will have a foot up on every other graduate. I don't care what discipline you have. If you sit down with the department director, you sit down with the administrator, you sit down with the director of nursing, or who have you, and you can demonstrate to them that you've had a skill set in those 2 areas, you're going to be a preferred employee over any other employees that are making the application for the job. So, with that preamble, if you will, I'm really here for Q&A. And remember, fear not. The first one that speaks gets a unique prize. Oh, okay. All right. Here goes. This always costs me so much money. No, I always do this. I always do this every lecture I give. And you can give it back to the university if you want to. Okay. That's all. It's only one time, folks, so I don't see a whole bunch of hands, okay?
I'm just wondering if you